Some of the most prevalent rumors about Marilyn Monroe revolve around cosmetic procedures. From a nose job to silicone breast injections, Marilyn's appearance gets heavily dissected by fans and critics alike as they attempt to explain the transformation from Norma Jean to Marilyn Monroe. This is the only procedure we have documentation for, as well as a newspaper article explaining the procedure away as a fall. In November of 1950, Marilyn went in to get a bovine cartilage or medical sponge implant, reports differ on the material used, inserted into her chin. The procedure, performed by Dr. John Pangman in Dr. Michael Gurdon's office and assisted by Gurdon's nurse, Dorothy Henderson, alleviated the slightly undershot jaw she received from her father to give her a more sculpted profile. Marilyn visited Gurdon in 1958 due to some pain and a minor deformity in her chin while filming Some Like It Hot. Gurdon discovered the implant had dissolved, causing the pain. To the best of our knowledge, Marilyn never received another implant to alleviate this problem. In 2013, paperwork from Gurdon went up for sale for auction at Julien's. Gurdon's 1958 notes, updated to reflect her new address on Fifth Helena, sold in a lot with her 1962 nasal x-rays for $25,600. I'm going to start by saying that nothing to my knowledge has come out supporting Marilyn receiving a rhinoplasty. Henderson could clearly recall the chin implant, but did not remember anything being done to Marilyn's nose. However, there is a slight cartilage overhang on Marilyn's nose that's in the greater cartilage area that's gone by 1951. It seems likely that Marilyn did have something done to her nose to remove this small cartilage tissue, but the results were quite minimal and only slightly noticeable in profile. It appears nothing was complete on the bridge, lateral cartilage, fibrofatty tissue, or lesser cartilage area, which is why many before and after pictures look exactly the same. Just like rhinoplasty, this is another procedure that seems likely, but we don't have any documentation one way or the other. I think there's a really heavy stigma that comes with discussing electrolysis during this time due to the 2 years Rita Hayworth had to put in to get her hairline raised, but electrolysis was one of the most common procedures completed during the studio era. 1930s through 50s studio heads really appreciated a high forehead and square hairline, and many Fox stars received the procedure, including Don Amici and Jane Mansfield. The results of these treatments were quite minimal sounding, but could drastically alter a star's appearance. Mansfield received a half-inch rise in her hairline within 4 months, and it seems like Marilyn was subjected to the same treatment as well. This treatment gave her hairline a neater appearance as well as becoming more square than rounded. There's some debate on when these treatments were received, with many people theorizing Columbia, but I would wager it was paid for by Johnny Hyde, as Marilyn's hairline takes on a more square look when she was with him, and she kept that same look. I'm going to keep the next two relatively short because there's nothing to support them, including photos. The breast injection stories claim she got silicone directly injected into her breast tissue in 1962, resulting in rock-hard breasts that were chronically inflamed. Although silicone injections were a procedure completed at that time, Marilyn's nude photos with Bert Stern and Lawrence Schiller do not support this claim, nor does her autopsy report. This is a relatively modern one, and I want to point out that I can see why people think it's plausible. Although some form of the brow lift was around during this time, the surgery was invasive, costly, and took time to recover from. There were other options, including electrolysis combined with widening the eyes when posing and crafting a new brow style, that seemed like the more likely explanation for Marilyn's brows seemingly going higher up on her face. Marilyn's plastic surgery decisions were entirely her own. Although there are numerous other rumored procedures, the most likely course of action was relatively minimal work with the goal of enhancing what was already there versus making an extreme makeover, as many people claim. What plastic surgery rumors have you heard regarding old Hollywood stars? Let me know in the comments, and don't forget to like and subscribe.